It's nice to be here in the Freedom Hall, and it's really nice today to be launching the digital strategy. I'm really pleased that there's been so many participants taking an active interest in the health and care strategy for Jersey. I'm very pleased from the support that I've had over the last few months in generating that, and particularly from Chris Knight, who has been my navigator of the complexities of Jersey. I'm also very pleased that I haven't become a subject of the health and care system by not walking up this stage, which is a focus of my mind trying to get here today. Now, today we're going to launch the health and care strategy. You will be able to access this afternoon. It'll be available on the Digital Jersey website. I can't in 15 minutes hope to give you the detail of all that strategy, but I can give you the essence of it. I can give you the flavour of some of the key aspects that we are committing to in the strategy. So let me take you through some of those things. We have a grand aspiration with this strategy, as Tony says, to make Jersey a world-class place, recognised for how we use technology in all walks of life, but particularly in the health and care space, to make those significant improvements that we are so desperately needing. This government committed in 2012 to transforming how health and care worked on the island, and since then there's been a massive investment and lots of work in developing the strategies for primary care, the strategies for how we deal with acute and emergency medicine, and those things are best enabled and supported with appropriate technology. We want to do that in a way which makes those services operate efficiently. We want to do that in a way that makes those services operate in the safest possible way. And we want to use technology almost as an invisible device. You know, we want our health and care professionals in Jersey to be using technology seamlessly as part of their process and not have to focus on the fact that they are using a particular device. It's just a natural part of the way in which you do business and way in which you deliver health and care on the island. We also want to make sure that we can make that big leap, which is joining up health and care. We'll talk a little bit today about some of the difficulties of joining up activities across what is actually a very complex environment. Health and care is a difficult, complex business that involves lots and lots of agencies and lots of processes. Joining that up is quite a challenge, and we think we can do that by joining things up with technology, and we'll talk you through some of those things today. We also want to focus on using technology to make change. The great thing about technology, and as Tony has alluded to here, you know, this was a cinema. It's changed over time because people are now watching films on iPads, on different devices. They're consuming things in a different way. That will happen to health and care as well. So we need to make sure that the technologies that we put in place are constantly regenerating and are constantly fitting and supporting the way in which health and care is to be delivered on the island. So, we think that's a grand aspiration. We think that's an achievable aspiration, and I'm going to walk you through now some of the components of how we think we're going to do that. I've said health and care is a complex business, which means every part of health and care and all the agencies involved in that are all creating and keeping records about patients and service users. And those patients and service users don't just land in one service. Many of those service users are consuming multiples of those different services. So in order to make this work effectively, we need to make sure that the records and information that is captured in one place is available in other contexts so that health and care professionals can make the best judgments that they can at the point that they are delivering care. Now, we wouldn't design it that way if we were doing it from scratch. That would effectively be one bubble on the page. So what we're trying to do with the digital strategy is work to try and bring those bubbles together so that we can actually create more of a record that is universally usable by all the health and care professionals in Jersey. So what we're trying to create, and this is our first major commitment with the health and care strategy, is what we're calling a Jersey Care Record. And the Jersey Care Record is an amalgam of data and information about individuals that is available and accessible by health and care professionals with appropriate controls and appropriate governance to make sure that the right information is available at the point of care, and the right information helps the care professionals make the best judgments that they can at that particular point. makes the safest judgments that they can at that particular point, and is done in a way which health and care is joined up in an efficient process. Many of these areas are already on a strategy of implementing computer systems that will increase their ability to digitise records. Now, that's a hugely important part of the journey as part of this digital strategy, because without a digitised record, without that being the first foundation stone, you can't actually send a record anywhere else. You have to put it in the post, or you have to move it physically from one place to another. And that gets in the way of effective joined-up care. So we're working with organisations to try and lift the digital records keeping capability of each of the institutions so that they are capable of storing structured, clinical and care information in computer systems that then give us the foundation stone for being able to share information between services. And the Jersey Care Record that we create in the middle of that is synchronised with all of those services so that information in secondary care could be shared with primary care physicians. Information in primary care could be shared with adult social services if the appropriate context is right for the care of that individual at the time. We effectively use the care record in the middle as a little bit of a postbox in some senses, being able to move information from one place to another safely and securely to allow care professionals to join up information, make the best decisions they can, and deal with the whole patient rather than just a bit of the condition or treatment that they're actually working on at that point in time. So our first commitment is to make that a reality. We think that's doable on the island, and we're attempting to do that over an incremental stage, starting right now, with work that's already being done in the hospital, so work that's already being done in primary care. We're building on foundations of systems that are already in place there, and gradually over a period of the next 10 years, we will increase the quality and the content of information that's available in that Jersey Care Record. That information will be viewable and accessible by care professionals, but also importantly, we want that information to be viewable and accessible by patients and cared for individuals. So we are making a second commitment in this strategy, which is by 2019, we will have an online portal where you can access your care record with the contents and information that we see here, but also be able to control that information and control who can also see that information, which other care professionals, and how you want that information to be shared. We also want to make sure that you can then interact with that information so you can do something useful as a result of seeing your care record. You might want to make a booking for a service. You might want to change some details in that record. We want to enable all of those features and capabilities as part of delivering a Jersey Care Record. Why is it important? I mentioned earlier on that actually patients are complicated things. They don't just have one condition. Many of the patients and service users now are using multiple services and actually have complex care pathways that extend over multiple years. And this is a real example. This is my dad. My dad's got severe dementia, and my mum struggles to care for him. And they go through any number of institutions. And my dad's pathway has been in primary care. He had an event in hospital to have his cataracts done. Then he fell over and broke his leg. Then he ended up back in primary care to change his medication. Throughout any particular individual service user's journey, there are multiple interactions with the health and care system. Now, in my parents' case, my mum follows my dad around and helps him through all of these appointments because she's the only one that can remember when the appointments actually are. She also takes a sheet of medications with her that my dad is currently on. Because guess what happens? In every one of these institutions, we're not quite sure what the medications my dad is on. And that's because there isn't a care record in the background that's available and accessible to the care professionals throughout that journey. Now, the unfortunate tale about this particular case is that my parents don't live in Jersey. My parents live elsewhere. And where my parents live, they are not developing an integrated care record. So there is little chance that my parents will be able to capitalise on some of the things that we're talking about in Jersey here. If we do this in Jersey, we are able to create a portable care record that moves with the patient as the patient traverses different institutions. It means that the care professional in any one of those institutions, at any contact point, can see the current information about that person at that time. And that means safer care. It means more efficient care. It means less wasted appointments in hospital because the right information isn't there at that particular point in time. It also means that if something happens on that journey to change things, for example, when my dad had his emergency care episode, he broke his leg, there was a whole series of appointments that were booked for him that were part of his normal care plan that all had to be changed as a result of that. Now, with a digital record and with digital joined up health and care, we can know that those things exist and make those changes at different points in the process, earlier in the process, and be more efficient in using those limited resources that we have available in health and care environments. So, there are many benefits to having this portable record. There are many benefits to it being able to be moved along the journey with individuals. There are also some what we call advanced benefits that we think are possible with creation of this Jersey Care record. Think about the scenario where we have a child that's turned up in the emergency care department for the 7th time, apparently have fallen downstairs again. To understand the context of that individual at that point of care, which is a very stressful situation for all involved, to make a decision that that person is at risk, and then to communicate that to multiple agencies who also need to know about that. Currently, that's quite a complicated thing to do, and care professionals do this. They write letters, they ring services, they try and get the best possible thing that they can to work. But if we are able to do these things electronically, we might pick up more of those situations that are risk situations, because the technology can be used to identify that that is the 7th time that that person has been in, and actually notify automatically those other agencies that that is the situation. So with a basic foundation of a Jersey Care record, it gives us an ability to layer on more complex logic and technology that allows us to pick up more situations and more intelligence about what's happening to an individual, and to act on that appropriately. Now, I want to keep that word appropriately in your mind. So the thing that everybody cares about with online care records is where they are, how safe they are. Can anybody access my record? Can anybody add information to it? Can anybody see that I've been to whatever clinic it was and I've got this particular condition? Well, no, that's because we control access using very, very tight protocols, and we make sure that the information is in very secure places. Your digital records at the moment in hospital environments are in a very secure place. What we're talking about here with the Jersey Care record is building on the foundations of the things that we've already got and extending those to integrate with other care services across the island. So we expect patients to be able to access their records, so they will need to be properly authenticated, authorised to be able to get into the record, as will every health and care professional on the island, so that we know who's accessing that information, that they're accessing it appropriately in the right context at that moment in time, and that we've got an audit trail that is visible and transparent to every other care professional in the island of who has accessed that record at any point. Now, where that kind of thing has been done elsewhere, and there are many examples around the world, the Nordic states have done quite a lot in this area, particularly Denmark. If you look at Denmark, have an online portal for patients and professionals, which looks at the Danish care record, which has very, very visible and transparent protocols for who has accessed information at any particular point in time. And if you're worried about that, as a patient, you can have the conversation with the care professional about why a secondary care consultant might have looked at your record at that particular point in time, and have that situation explained to you. And if there's any worries about that, then there are methods for raising and escalating those concerns through channels like your care professional, your GP, or your secondary care consultant. So we take the security and we take the access protocol stuff extremely seriously. There is going to be, and there is another commitment in our strategy, a group assembled to establish the protocols that will govern and shape the access to the Jersey Care record. And that's going to be a group comprised of care professionals, academics, ethicists, members of the public, patients and service users, so that we establish a true and transparent way of governing access to information and records, and that we shape that portal and that online record so that it best fits how people want to interact with it. What is our timetable for doing these things? Now, I've only really mentioned Jersey Care record. I've not at all talked about things like Internet of Things. I've not talked about how we might use iPads. But of course, they do feature as part of our landscape of delivery. We are concentrating, though, on making sure that we can get structured record information established in every care setting, so that we are working, for example, early in 2017 with the ambulance service to get them a computer system that allows them to capture structured information. Because if we can get ambulance services to capture information in a structured digital system, it gives us the ability to integrate that information, to send that information into secondary care, into the emergency situation, at the point of care, at the point of delivery. And as well, it improves the efficiency of their processes. It means they're not writing out information on bits of pink sheets in the rain in the back of a van as they're doing handover into secondary care. There's a whole raft of improvements that have come with simply creating that digitised record and creating that exchange. So a real focus on systems early on. In 2017, the other big commitment that we're making is to deliver integration between primary and secondary care for the mass transactions that happen for test requests and results. At the moment, that's a largely manual process. Lots of paper moves backwards and forwards when you have a test requested from a GP surgery that actually gets the results are generated in secondary care in the hospital. That information then flows back and then it's rekeyed into the local primary care system. We're doing that electronically in 2017. So that massively improves the efficiency of that process, but it also includes the clinical richness and content of information that's available to care professionals in the primary care setting. And maybe later when we talk on the panel, Nigel Minihane, who's been a big supporter of all this, will describe some of the aspects of how that will change primary care in his world. So we're doing some things in 2017 that will make a big difference. In 2018, we're moving that forward to expand into electronic discharges, and we're starting to generate the first formative parts of the Jersey Care record that will become the online presence of that record over time. And by 2019, we expect that to be in place and usable by most people on the island. Of course, we need some skills and training to do that, because not everybody's familiar with the technology. But of course, we will have, through the Digital Eagles programme, through the training that's coming through Digital Jersey, an ability to influence and to shape and to bring people skills so they're able to consume these services. So now, of course, that's not everything that we see on the digital journey. This digital journey extends well into 2025 and beyond, because technology doesn't stand still. Health and care services don't stand still, so we need to be able to continuously regenerate and continuously support how health and care is transforming on the island. In the strategy, there are 31 commitments that we've made. I've illustrated some of these today, and we've talked about some of the cornerstones, but I would encourage you to have a look at the strategy later on today and see the areas in where we're making substantial commitments to make these changes to health and care and how they are supported with appropriate technology that will increase the efficiency of services, that will make them safer, that will join things up more effectively, and will position Jersey as a centre of digital world-classness for how we use technology to support health and care effectively.